My name is Singh-Guerra, and today we will be discussing a patient safety concern in my workplace, which is to increase the adherence and compliance of staff members to wear personal protective equipment on patients on contact precautions on the behavioral health units. Many of the reasons that I've observed that staff members do not comply with this issue is due that the PPEs may be too far away from the patient's room, or they feel that it's a nuisance to just wear all that equipment to go into the patient's room and to do simple tasks such as taking vitals. In this video, we will be discussing how to improve this patient safety concern. Under the section of contact precautions in the Joint Commission website, it strongly suggests that healthcare personnel abide to recommendation VB3BI from the HCPAC guideline for contact precautions, which states, wear a gown whenever anticipating that clothing will have direct contact with the patient or potentially contaminated environmental surfaces or equipment in close proximity to the patient. It is important to note that nurses and other healthcare professionals may not comply with the use of personal protective equipment for many reasons. What reasons are these? According to Kim et al. 2015, such reasons include discomfort, lack of time, knowledge, or even forgetfulness. Another reason staff may be non-compliant with the personal protective equipment may be due to negative role models. Nurses or other healthcare professionals see that others are not being compliant, so they feel like they don't have to be compliant as well. According to Valim Marzial, Richard Martinez, and San Juan Quiles, 2014, other important factors that contribute to the noncompliance of PPE with contact precautions may be due in part to lack of support from management, the environment in which healthcare professionals work, lack of education, and motivational factors. According to WETH 2013, the problem may relate to the overusage and not knowing how to properly use personal protective equipment, which leads to an increased risk for hospital-acquired infections. This is when proper teaching and training is required. Inappropriate usage of PPE is just as bad as not using it at all. In turn, this results in higher costs for facilities to supply them and may result in short supply or availability of such equipment. According to Valdez 2015, the Center for Disease Control has dictated and set standards for the proper usage of personal protective equipment in order to prevent the spread of infectious diseases spread by contact, directly or indirectly, or exposure to objects in the isolated environment. The use of PPE can prevent the exposure and spread of pathogens such as the norovirus, rotavirus, MRSA, VRSA. According to Hicks and Patrick 2013, healthcare personnel should use PPE to prevent the spread and exposure of other virulent and very dangerous pathogens, such as CRE or Acinetobacter baumannii. How to tackle this patient safety concern? I will use the model for improvement to tackle the safety concern. This model begins with 3 simple questions. After answering the questions comes the Plan, Do, Study, Act cycle. This 4-phase process allows you to test changes in a small scale, observe what happens, tweaks them as you go, and test again. This is a much simpler process than others, and it enables rapid testing and learning. The aim for this theoretical project is that in 2 months, 100% of healthcare workers on the day shift, 7 a.m. to 7 p.m., will adhere to the hospital-required personal protective equipment for patients on contact precautions. One specific and measurable strategy that I will implement to change the safety concern in my environment is to make PPE accessible by keeping PPE equipment outside of a patient's room. The second strategy would be to make a checklist in which staff has to sign. I would then be able to cross-reference and supply usage and staff signatures. Lastly, the nurse educator and I would develop a section in a patient's flow sheet in the EMR, which would ask if a patient is on precautions. If answered yes, a pop-up would come up requesting staff to wear PPE equipment. Now, I would conduct a PDSA cycle. I will discuss my project initiative with my administrators and the infection control nurse. With the feedback from the infection control nurse and staff, we will create a poster to remind staff on wearing PPE before entering a patient's room on contact precautions. The poster would have a slogan that would read, PPE, it's easy as 1, 2, 3. The poster would have bold lettering to capture the attention of staff. The created poster would then be attached to the PPE cart outside the patient's room door on contact precautions. I would then conduct a test on a small scale. I would observe 1 patient on contact precautions for 7 days and see how many healthcare personnel are complying with PPE use after the implementation of the poster. If the poster does indeed improve the compliance of PPE usage, I will increase my observation scale to 2 or 3 patients. If multiple tests are successful, the poster is ready to be the new implementation standard on the unit. If testing is unsuccessful, I will adopt, adapt, or discard. Class, this is my reference page, and thank you for watching, and I appreciate your time.